Our engineer in the UK asked the question, what is the state of cancer research with respect to finding solutions? Actually, very advanced, actually. Many of these things I'm mentioning are actually due to the research. For instance, this immunotherapy is something that is really, really recent. In fact, and it's not just abroad, even here. For instance, there's a study I was involved in that shows that much of our colon cancer in Nigeria, 28% of our colon cancers is the kind that can be treated with that immunotherapy. Hello? Are you hearing me?
Yes, you are hearing you. Yes, you are hearing you.
Yeah. That shows that in Nigeria, 28% of our colon cancers are the kind that can be treated with immunotherapy, compared with 14% in the US. In fact, so really, there's a lot of cancer that is doing cutting-edge cancer research. There's CAR-T. No, really, I think by God's grace, we should be a lot of progress is being done. A lot of progress is being made, and cancer is becoming more like a chronic disease, especially if caught in the early stages, is either cured or turned into something like a chronic disease. Even stage 4 cancers, many stage 4 cancers are now become like chronic disease. Like the patient doesn't just die, even though it's advanced. What causes the failure of oncogene and suppressor? Either two things: bad luck or the predisposing factors, or someone who has a genetic problem. As I said, those people that have genetic transmitted disease, the problem is in the DNA of their oncogene and tumor suppressor genes already. So whenever they have a child, the child is, especially if the child is homozygous for the thing, the child is predisposed to having those things. It's like a factory. If there's a problem with the what they call it, if there's a problem with the robot that makes the components for the brake of the car in the factory, know how that the cars that are produced on that factory won't be predisposed to having brake failure now. Only that, unfortunately, there's no issue of recall in this matter. So the next one is, does it mean the genetic or familial ones can't be broken? Actually, that's a very difficult one. It's only maybe gene therapy, and those are very, very few cancers can be dealt with that. Actually, it's still a work in progress. So it's only with gene therapy that that can happen. What makes some types of cancer to be prevalent in a geographical area? For instance, for example, you said Asia has bad cancer, such as liver cancer. Asia, they are not as healthy. I mean, the environment is not as healthy, so they think liver fluke. As they have a lot of liver fluke, which can go into the liver and cause irritation and cause that, and they tend to have a higher incidence of hepatitis B and C. See there. So the things that predispose to that cancer, if it's a lot in a place, the person will have it. Like in Egypt now, they tend to have a lot of bladder cancers because they have a lot of schistosomiasis there. So schistosomiasis causes problems with the bladder, which will now predispose to having bladder cancer. So usually when you have a lot of cancer somewhere, it's usually because the predisposing factors to that cancer is prevalent in that place. So how does lack of physical activity cause cancer? Lack of physical activity, for instance, the patient is obese. Okay, let me give an example now. If someone is very obese, it's not just in the ovaries that those hormones that they cause breast cancer to grow. It's also produced to a little lesser amount in the adipose tissue. That means the fat cells. So if there's plenty of fat cells in the body, those hormones are produced more, and understand it can now predispose the patient to the cancer that hormone is. So that's just one of the, so that we don't. So what's the link between family planning and cancer? I wouldn't say. See, in the olden days when they used to give when the pills that were used for family planning were had very high estrogen levels in them. Used to be because those estrogen are hormones. So if there's plenty of hormone, there's plenty of exposure to hormones. It can predispose to breast cancer, and perhaps ovarian cancer. But now, really, the very low dose things that are given, these pills. So the association is much, 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 much less. So it's not as if you do family planning, you're going to have cancer. No, it's not like that. Yeah. Is there any relationship between hemorrhoids and cancer? No, no, there's no relationship between blood hemorrhoids and cancer, really. Because two things causing the being having a single presentation doesn't mean they are related. Hemorrhoids can cause bloodings too. But there are some questions we ask that we know that is this one hemorrhoids, is this one cancer? When hemorrhoids will not cause the person to be lean and some other. So there's no relationship between hemorrhoids and cancer. Broad strokes. Do dark skinned people have ultraviolet cause cancer? No, 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 much, much less. Usually in light skinned people living in tropical areas like Australia and those things. So I don't think a black person needs to be wearing sunscreen all the time. Where can we do pap tests for free? I'm not sure. I'm not a gynecologist. A gynecologist know that better. But I wouldn't know. I wouldn't know whether. I think the best place to ask is the teaching hospitals whether they do the pap tests for free. Yeah, is it true that cancer patients should abstain from anything sugary? No, it's not correct. Yeah, it's not correct. So if I've seen a PhD person that insisted that once you stop eating sugar, the cancer will go. Of course, she died. She refused treatment. She said once she stopped, whether you take the sugar or not, the cancer will feed itself. Is bleeding gums in adults a symptom of cancer? It can be for leukemias. Leukemias can cause bleeding gums, which is a kind of blood cancer. So it is a symptom of a specific kind of cancer. A few possible prevention of cancers. I've mentioned it earlier. I'm presently caring for my wife who was diagnosed with stage 4 breast cancer. I wouldn't know. I'm not in charge of the story, but we pray that she has a good outcome. But stage 4 breast cancer, depending on the biology of the tumor, I've seen patients with 10 years after having stage 4 breast cancer still alive and kicking and doing well. Like we see Diziani now that some people are saying that she doesn't have, when she says she has breast cancer, and people are saying, yeah, why hasn't she died? Because she has, actually, she can still be alive and doing well and going all over the place with her stage 4 breast cancer. So we pray she has a good response to treatment and she does very fine. And you still have a long time with your wife. And last month, have mercy on us and her and preserve our health. Something growing to cover the eyes was surgically removed and is growing back. What can I do? I would think that is likely, what came to my head is that is likely to be a plexiform neurofibroma. The person is likely to have all sort of dot, small things growing all over the body, and there's now a large one going to cover the eyes that they removed that's coming back. It's like possibly a plexiform neurofibroma. I think you should just see the surgeon in a proper surgeon in a proper place that will advise what can be done, what it is and what can be done. In the face of high treatment costs associated with cancer, what steps can the government or foundations take to provide subsidy or financial aid? I would still think the best thing to provide healthcare is either a national health service where taxes are used to fund it or insurance. I think that's the best way because healthcare is a very, 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 especially cancer care, very, very fund intensive. So I think that's the best way. And a person have cancer and completely healed up just like that without taking any treatment. That's extremely rare. The body should, the person should go and treat the cancer and not wait until the body takes care of itself because that will be an extremely rare occurrence. And most of the cancers are not epidemiologically recorded. Does that mean that most of the time those? Well, I don't know about, people are saying all sorts of things about all sorts of things and people are dying. I've seen enough. So please, anybody that has a growth or something that is suspicious, go to a proper hospital where they can diagnose you and treat you. That's my advice. How expensive is the cancer screening exam? Well, depends on where it is. But I think the cheap cancer screening exams, many of them are widely available in like OAU, THC, and many of those federal medical centers and teaching hospitals and good private hospitals also. And the expense will differ depending on the place. Can someone below age 40 run all the tests? You can't run all the tests because when, as I said, someone is above 45 that it becomes sensible to do a colonoscopy, for instance. Someone below 40 is not usually even offered mammography because the mammography won't show anything because the breasts are still dense. So there are rules and guidelines for most of these tests. There are some that are just, and age is another extremely important thing. I forgot to mention age. As you grow older, you've been around for more longer. So the number of times your cells are dividing is longer. So older people tend to have cancers more. So many of these tests have age limits. Mammography for breast, 40 years. Colonoscopy for cancer, 45 years. So they have tests. So don't just go and do, because unless you have familial or genetic problems. Yeah, time is too short, truly. I actually made it, and I couldn't explain everything. This person probably is a medical personnel. For cancer, triple negative breast cancer found to be more common in African and Hispanic women. Research found something specific to predispose. Not really. It's just been noted that they have more. But one is hepatitis treatable or curable? Hepatitis is actually treatable and curable. Hepatitis is treatable and curable. Hepatitis C, in fact, by the time they treat, it's not even undetectable again. So hepatitis C is actually treatable and curable. I'm not in the Ilorin, sir. Dr. Brass Regina Blazis. I'm not in the Ilorin. Yeah. Okay. What are the chances of a cancer treated early enough reoccurring again? If treated very properly, most of the time, especially if it's early, it may not reoccur, but it's still possible it reoccurs. Depends on the size and the kind of treatment available and how done and how complete the treatment was. But cancers can always recur again. You mentioned early diagnosis as one way of reducing cancer prevalence. We now have cancer diagnosis centers. We have cancer diagnostic centers. You have in most teaching hospitals, federal medical centers, and good private hospitals. We have, and the knowledge is also developing too. More research in molecular genetics have found that errors in DNA. Okay, good. Research has gone to a lot in almost all cancer fields, really. But unfortunately, many of them are not available here. That's the problem. So may Allah improve our condition in the country. Training organizations be organized for medical personnel to enhance their skills in conducting specific cancer screenings. I think quite a lot of it is being done. And I'm a member of the African Research Group in Oncology. They are doing enlightenment programs. So, and it's open for nurses. There are trainings for nurses, trainings for pathologists, trainings for every aspect of medical care.
Anyone?
So browse African Research Group in Oncology, Nositodo. And we have, in fact, we have our conference, yearly seminars coming up September. It's just been advertised.
You said African Research what?
So African Research Group in Oncology, argo-research.org. Just check it up. You can browse it. African Research Group in Oncology. You can attend the seminar in September. And there are many different training programs available that you can latch on to from there and improve your knowledge about it and training in all these fields. Clinical trials done in research labs around you. Well, there are more and more clinical trials being done properly now. You know, clinical trials, you need funding, you need training. So more and more are being done, including, I'm coming. I had a principal investigation mentioning that clinical trials are what? I'm not okay, let me see whether I can expand this so I should be able to see what the person is talking